Hello and welcome back to The Vision Mechanic. Today, in this episode, we're going to talk about snow blindness, also known as photokeratitis. I'm going to spell that for you. Now let's spell that over here, not on my face. There you go. And beyond that, photokeratitis, snow blindness, is also known as welder's flash. So what are we really talking about here? We're talking about an excess exposure to UV rays, in particular UVB rays. And so in certain environments we have higher concentrations of these. Basically out in the open sun, there's certain risks to it on any day, especially clear days. But sometimes, like in a snowy environment, we can have an excess concentration of the rays bouncing off the environment into our eyes. And there's different ways of protecting for this, but if we're not protected, then what happens is literally the surface, the epithelial cells on the surface of the cornea, they're effectively cooked. It causes a cell death, and that leads to all kinds of trouble. It's miserable, it hurts, you tear up, your sight is affected. It's just not a nice place to be. And so if you're exposed to too much rays from the snow, from reflections off the snow, or on a beach, or if you're a welder, again, welder's flash. So if you're welding without your mask in front of you, then definitely, you'll have that exposure. Everybody knows this. I treat welders frequently. Thankfully, most of them are smart enough to wear their masks, and so I treat them for grinding issues, metallic foreign bodies in the eye, and sometimes these are unavoidable, even with eye protection, it turns out. But anyway, let's get back to this story. So photokeratitis is also known as snow blindness or welder's flash, results in the same thing, this miserable cooked epithelial syndrome. And what are you going to do about it? Well, the last thing you want to do is treat it yourself. Best thing to do is go find your local optometrist who will have a good look at you under the microscope, maybe use some dye to visualize the surface tissue, some yellow dye or some other dye, some green dye perhaps. And they'll have a look and they'll make sure that that's the diagnosis. And if that's the case, it makes sense to give you antibiotics, some drops just to prevent infection, because your epithelium is critical in protecting your eye from bacterial infection. So we're going to give you an antibiotic cover for possible infection. We're going to recommend some oral analgesics, something to deaden the pain a little bit. But unfortunately, there's not going to be a lot that you can do. I'm not likely to give you a drop, like an eye drop, to dull in the pain. That would make things worse. But what we will do is give you some comfort. Some people might give you a contact lens, a bandage contact lens to cover it just for comfort, but you have to watch that. You don't want to just sit on that for too long. But the good news is that after about 24 hours, you're really going to start to feel better. There's a delayed reaction when you first have it. You're going to probably sense something is wrong. But within a few hours, you're going to start to feel teary, the pain, your eyes are going to be red. And then beyond that, about 24 hours after that, you're going to start to feel much better already. And do follow your optometrist's instructions. You're going to want some artificial tears, something non-medicated, not an eye whitening drop, like a Visine or a Clear Eye, something like that. That's absolutely the wrong thing to use. That said, you can avoid all this. You can simply wear protective eyewear. Now, UV blocking glasses do not have to be dark, and likewise, not all dark glasses are going to block UV for you. And so just remember, wear the proper eye protection, and if you're outdoors in a sunny environment, it certainly doesn't hurt to wear even better protection, upgraded UV blocking, and in that case, also like a polarized lens, which definitely blocks down a lot of the rays that are incident on your eyes, your cornea, and your conjunctiva, the clear skin covering the eye. Now the cornea and the conjunctiva, they don't have pigment, and so they can't really absorb the rays. They suffer the consequences. You do want a bigger lens for the outdoors. Let me throw that in. Give you broader protection, and then of course if you're in that kind of an environment, you also want to protect your skin. And so beyond that, let me throw this in at you. So we have all kinds of great technology for UV blocking nowadays. Like I said, polarized and UV coatings, fantastic stuff, up to 100% protection for you, and that's amazing. But let's go back to the glasses. So what did people do before they had lenses, high technology lenses with 100% UV filtering? Well, they did what they can. And so, for example, the Inuit of the circumpolar region, the Yupik of Alaska, for example, and throughout the Canadian North, the Inuit people, they used bone glasses or slit glasses that were made from other materials, including wood and caribou antler. And so these glasses, I'm going to show you a picture of it right here, and these glasses are basically solid and they have a slit. There's a couple of great benefits that go along with this. Of course, immediately you're reducing the incident UV rays by a significant amount. It's not going to be 100%, but depending on the manufacturer, the cutting of the slit, you can really reduce it to 90%, maybe even more. I mean, you'd have to measure it, we'd have to measure it, but very effective in just blocking incident light, so it allows only the minimum light through you need to see. What's the other advantage? With the slit glass, a slit spectacle, basically, you've got a very tiny aperture. And if you know photography, a small aperture gives you greater depth of field. And so with that, you put the glasses on, it's less incident light, so it's much less glare for you, you're safer, and you also get a greater depth of field for what you're looking for as a hunter. That's pretty helpful. The other thing is if you happen to be nearsighted, that slit will actually correct for a good portion of your distance vision. The same works for astigmatism. Anyway, just some thoughts for you. All of this to come to a basic lesson: protect your eyes, especially in these environments. Photokeratitis is completely avoidable, almost always. I mean, if you're in an industrial environment, you should be protecting yourself anyway. You should not be operating an arc welder while there are other people around who aren't protected. Anyway, for what it's worth, take good care of your eyes. It's the only pair you get, and no, we cannot replace it with AI, and we cannot give you a bionic eye. With that in mind, we're going to let you go. Be sure to like, subscribe, and click for notifications, and we'll see you in the next video.